We're in the peak of the summer with lots of ticks around us here in Suffolk County, so we're going to take a few minutes to talk about what to do to prevent tick infections and what to do if you find a tick on yourself or your child. Stony Brook has a long history of research into Lyme disease and other tick-borne illnesses. It turns out that the first ticks that were found to have Borrelia burgdorferi, the bacteria that causes Lyme disease, were actually identified by researchers at Stony Brook and then used to develop further lab testing to help diagnose the disease in humans.
Lyme disease can be acquired through the deer tick bite. The symptoms usually include a fever, headaches, muscle aches, joint pains, sometimes a rash. In particular, most people are familiar with the bullseye rash or the target rash.
The most important thing to do to prevent tick infections is to avoid going near high grasses and areas where the ticks live. If you do go in those areas, it's a good idea to wear long pants and long sleeves. You should tuck your pants into your socks and spray mosquito spray or insect repellent to help prevent the ticks from biting on. Once you come back in, make sure to do a thorough tick check. You can also take your clothes and put them in the dryer on high heat for 10 minutes, which kills the ticks. If you find a tick on yourself, the first thing you want to do is find a pair of tweezers. You're going to grasp the tick by its head, right where it's biting into the skin, and firmly pull straight up. You don't want to twist the tweezers while you're doing it, and you don't want to add anything else onto the tick, like petroleum or trying to use a match to help it get off. All of those things can just harm yourself and aren't helpful for removing the tick. Once you've removed the tick, you want to contact your primary care provider. You should take the tick and actually put it inside a clear plastic bag or some tape and bring the tick to them so that they can help identify it.
If you suspect that your child has Lyme disease, you could talk to your doctor initially. We're also available at Pediatric Infectious Diseases here at Stony Brook for an evaluation. There is blood work that can be done in order to help diagnose the infection, and then we would treat based on the results accordingly.
There's a lot of misinformation that children who are infected with Lyme disease have the infection for life, and that's simply not true. We know that patients who are treated with antibiotics do respond remarkably well. A very small portion may have some symptoms lingering afterwards, and you can speak with your provider about how best to treat those.
So as we know, the deer tick is on Long Island, and many people are familiar with Lyme disease, but there's another tick in our area that's been on the rise. This is the Lone Star tick. The Lone Star tick can transmit other infections, not Lyme disease, but it's important to recognize these infections as well.